Human Papillomavirus.
Like 80 million Americans are currently infected with a type of human papillomavirus.
Human papillomavirus is the most common sexually transmitted infections. This virus can cause various types of cancers like anal cancer, throat cancer, vulvar cancer, or penile cancer. It can cause life-threatening conditions. Although it is a very common type of virus, but it can encompass over 200 related viruses. HPV has a simple structure consisting of two main components. One is the capsid and the second is the genome. The outer protein shell of the virus. It consists of two structural proteins, L1 and L2. L1 is the major capsid and L2 is the minor capsid. It helps the virus attachment and entry into the host cell. Inside a capsid, there is a viral DNA. HPV genome is a circular, double-stranded DNA molecule with approximately 8,000 base pairs. The DNA encodes several proteins necessary for the virus to replicate and evade to host immune system. HPV is categorized into low-risk and high-risk types based on their potential to cause disease. Low-risk types include HPV-6 and HPV-11. These are associated with benign conditions like genital warts and low-grade lesions. They are not typically linked to cancers. High-risk types include HPV-16 and HPV-18. These types are responsible for cancers, include cervical cancer, anal cancer, and oropharyngeal cancers. HPV can be transmitted from skin-to-skin contact during intercourse. This includes intimate contact with an infected partner, even if they show no visible symptoms. There is also a vertical transmission from a mother to a child. This condition involves the growth of benign warts in the respiratory tract, which can cause breathing difficulties. Papillomavirus can also spread through contact with contaminated surfaces or objects, though this is less common. Ensuring proper hygiene and avoiding the sharing of personal items can reduce the risk of non-sexual transmission. The cycle begins when the virus enters the body through tiny cuts or abrasions in the skin or mucous membranes. It targets basal epithelial cells, where it integrates and uses the host machinery to replicate. Early viral proteins that are E6 and E7 disrupt normal cell processes, promoting uncontrolled cell growth. As infected cells move towards the surface, the virus replicates its DNA and assembles new particles. These mature viruses are released when the infected cells shed, ready to infect new host. The cycle is often asymptomatic but can cause warts or in some cases cancer in persistent infections. Human papillomavirus can be presented with a range of symptoms and complications. The common symptoms include genital warts, which include small growths or bumps on the genital or anal areas. Symptoms also include cervical dysplasia, which refers to abnormal cell growth on the cervix. HPV can be asymptomatic also. This nature can make it challenging to detect and prevent the spread of the virus without regular medical checkups. HPV can be prevented by vaccines like Gardasil, Cervarix, and Gardasil 9. These vaccines are highly effective in preventing HPV. Regular Pap tests and HPV screening can be helpful in preventing HPV. Early detection through HPV tests and HPV screenings allow for the identification of abnormal cells. Procedures like cryotherapy, laser therapy, and loop electrosurgical excision procedure (LEEP) can remove warts or precancerous cells, preventing further complications. The cancer that is caused by HPV can be treated by surgery, that is the removal of tumors or affected areas. This can also be treated by radiation therapy that targets and destroys cancerous cells. Chemotherapy is also effective in this process. It attacks cancerous cells, especially in advanced stages or when combined with other treatments. If we summarize the key points of HPV, we will get to know that it is a common virus with over 100 types, some of which are linked with cancers and genital warts. The virus spreads primarily through sexual contact, often without noticeable symptoms. Vaccination, regular screening, and practicing safe behaviors are critical for prevention. We can encourage patient who is suffering from HPV for open conversation with doctors about vaccines, screenings, or any HPV-related concerns. We can emphasize them to take care of their health, and healthcare professionals are the best resource for tailored advice and interventions. By staying informed, practicing prevention, and seeking medical advice, we can collectively reduce the impact of HPV and protect our health. Thank you for watching this video.